Hi, everyone. My name is Dr. Amanda Selmser. I am a functional medicine practitioner with a background in traditional Chinese medicine and acupuncture. I've been in this industry working with women for about a decade, and I've quite recently changed my tune, and I am now working a little bit deeper with my clients in the world of functional medicine, using my background of energy medicine and Chinese medicine in their treatment plan. But what I have added to their care is a big component of diagnostic medicine. So, looking into the root cause of what's going on in women's health, whether it be a hormone condition, an autoimmune condition, something like COVID in the world we're living in now. So, what I'm seeing with my patients in long COVID is really interesting. They're not necessarily scheduling appointments to come and have their long COVID treated. But what's happening is my existing clients are experiencing COVID, and then we're going through the acute treatment phase, and we're treating maybe some of their symptoms, whether they were shortness of breath, fatigue, headaches, some digestive system disturbances, and then they're feeling okay. And then we see months later these don't want to say red flag symptoms coming up, but symptoms that are strange. Some of my clients are not only experiencing those hormonal imbalances, but again, the kind of roller coaster of fatigue. So feeling okay after they've battled COVID, and then it coming back up in a strange sort of form. So maybe there is a Chinook in Calgary. We live in the world of Chinooks, and pressure changes, and they've never experienced these symptoms before, but now all of a sudden around a Chinook, they're having a headache, maybe a migraine for the first time ever, and this overwhelming sense of fatigue, anxiety, maybe mental health struggles and foggy heads. So the long COVID symptoms that I'm seeing aren't all fitting into the same box. Every individual is experiencing them very differently. And it's not even a matter of the acute COVID flare-up and then the long COVID symptoms. It's coming into these bodies in ways in which we're just they're unexpected. So treating COVID is, again, when it comes to functional medicine, Chinese medicine, holistic care, it's about finding how it made its way into the body from an inflammatory perspective and what system is being interrupted. Functional medicine, at the end of the day, I believe is root cause medicine. So functional medicine is that missing piece of the puzzle. So finding out the imbalance and then getting to the root behind it. Is it an inflammatory food that you're eating? Is it a toxic environment you're working in? Is it a relationship that's causing a lot of stress? Is it, the overburden of balancing and juggling 1,000 things when your body's just screaming for rest? So very similar to how I've practiced always with my clients, and what I believe in is the best medicine for this world is finding out the imbalance, finding out exactly what's going on from a diagnostic perspective, and then really getting to the root behind that, investigating the whole person energetically, mentally, physically. So much more to us than just how we look in a doctor's office, how we come across on paper, and what we look like from a lab perspective. So from a urine, blood, stool, saliva analysis. So my clients come to me and they're ready. They're ready to do an eliminatory diet. They're ready to say no to some bad habits. They're ready to put up some boundaries, whether it be at work, in a relationship. They're ready to just take their health into their own hands. And then we use some science and we use some holistic medicine, and I put together these plans for my clients that really encompass everything. To me, it's not, and I know this sounds so cliche, but my job isn't a job to me. It is not work. It's what fuels me. I have been ill in the past, and it was the best I felt when I would go to work. So if I was having a hard day and my energy was low and things just weren't feeling as good as I knew that they could, I would go to work and I would come home and I would feel better. And I always wondered what that was, and that my job it's not so much work. It's helping me heal myself. It fills my cup. It's I'm beyond passionate about it. Yeah, so I work online virtually with my clients because of COVID at the moment. That may change, but for the time being, my clients can find me online, dramandaselmser.com. I have a website. I use the Jane app for booking ease for my patients. I'm on Instagram. A lot of people will send me messages there, and on Facebook, the same thing, Dr. Amanda Selmser, no fancy medical clinical name yet. So you can find me online for now. And, when COVID's over, I'm sure I will be making an entrance back at a clinic somewhere.